every living organism needs to be able to feel pain and to process pain as an information about, oh, something's going on, please look out, watch out, something is not right. So we all need, as individuals, pain, otherwise we might, I mean, like I myself, I still remember, and that's also something about pain, I put my hand on a glowing oven as a kid because it was red, and I was like, oh my god, it's so cool, I want to touch it. And immediately I felt the pain, and you draw the hand back. So pain is like, it gives you a sign, oh, be careful, something's not right. This of course, this valuable information is for acute pain, so you adapt. However, when it comes to chronic pain, very often this information part about the pain has gone missing. So your body processes, your central nervous system processes on an information that has no more this acute warning or urgency anymore, and you still perceive that information, you still digest on it, you feel it, and not that you know there is chronic pain where you actually have a physical, there is something in your body producing that pain. However, the amount of pain you suffer from does not correlate to what's going on in that body part anymore. And we know that especially chronic pain patients, they have a long history of suffering, because some of the patients, the clients, tell us that, you know, the doctor, they don't take me seriously anymore because they say there is nothing, and however I feel the pain, and of course I have to take the pain medication. So with ongoing pain over the time, you are more likely to go down an alley where you are faced with intake of medication that does not read prescribed medication, that does not really do the job anymore. You might even become more prone to sleeping, insomnia, sleeping problems. Your mood might alterate down. Your energy drive might get down. You might be more prone to have difficulties in your social network. So we know that chronic pain is really kind of getting you out of the good spot where you were originally in. And you suffer from a physical symptom that by time going on adds on physical symptoms, mental, I would not say disorders, but more or less symptoms, and it becomes a huge package. And clients end up not just with their pain that's much more or less somehow managed. You then have like a list of prescribed medication, sleeping medication, pain medication, mood, whatever, and you're not feeling well. The typical symptoms of chronic pain. Chronic pain can be any pain of your body. So I cannot, it's not like here, or typically it's, you have pain there, oh yeah, then you might know chronic pain. No, it can be all sort of pain, starting from the head, from headache, migraine, joint aches, spine, back, hips, knee, you name it. There is not a place that you cannot feel chronic pain. Important is that that with the chronic pain and with time, like other symptoms can add on, like insomnia. Your mood might come down to a depressed mood, energy, drive, sex drive. You might suffer from side effects of prescribed medication, of antidepressants. So there is a lot that can add up, and also we know, for example, that when you're on the other hand, when you're depressed, you're more likely to feel pain from inside the body and less likely to feel outside, like when we kind of poke you or whatever, and you do research, you see that somebody that's in a depressed state doesn't so much sense pain from the outside. Of course he senses, but he's more prone to feel pain that's coming from inside. So chronic pain and alteration of mood, drive, sleep are closely related. So the longer you suffer from pain, the more likely you might suffer from other mental symptoms, disorders too. The underlying causes of chronic pain, it's manifold. There can be, how much time have you got? So to speak. Really, it's like there can be there's not like, okay, you have pain here, and that's because something happened to you back then and you did not look at that and didn't process that. Pain starts in our nervous system, telling us, look out, watch out, something's wrong, you have to change, put your finger away, don't do that movement anymore, watch out. However, pain is originated not where you feel it, not here, it's really processed in the brain. So, of course, the way we function, if we are a happy person, if we perceive ourselves as resourceful, strong, if we have stamina to change, to be there, this all affects our ability also to process pain. And the important thing is with chronic pain that we help our clients with our different components of treatment here to allow the pain to process, to allow our clients again to even perceive the pain, and with that go back and work on biographic issues that happened, on again together find out what's let's say like what's behind the curtain, what stress factors are out there, what kind of a person are you, how do you cope with stress. So we help them in a non-chemical prescribed drug way to go on a journey, go back and find out, and lots of it is a reactivation of resources, and also of course of finding out with the client what resources do you have. Of course also an injury or a medical intervention can be a trigger of chronic pain, as long, chronic pain starts most of the time with, there is actually really something causing pain on your body. It's being processed in the brain, and this way of processing ongoing pain becomes an issue by itself. I can give you an example. We all have maybe some years back or now, like had an unhappy love affair, a divorce or whatever. So we got emotionally hurt. And all of us know that when you lose somebody you love through whatever the circumstances, you went through this phase where you actually feel pain in the body. You feel something missing, you might not sleep, you have no appetite, your interest in life change. And we know today that even like this abandonment from a beloved person triggers our our centers in the brain that work and process pain. So, emotional situations do also can also inflict pain in our body. So the way pain and chronic pain does not always need to have a physical spot in the body. It can also be the other way around. Emotional ongoing or emotional pain, loss, trauma does have an impact on our physics. So chronic pain is or pain by itself is produced, processed in the brain, and when you have a chronic state of pain, something in the way your brain, the centers in your brain do process pain, has lost its physical and physiological how do you put it in words? it's gone overboard. The way we treat chronic pain in the Küssner practice is a very, of course, bespoke and tailored way. Clients with chronic pain are very sensitive to, concerning their pain, of course. Is it coming back? How is it now? So we apply well-known research-based strategies in psychotherapy. It's about, it's mindfulness-based strategies. It's coming back to the here and now and not trying to escape from pain. So we have a full package for the psychotherapy. And then, of course, we also help our clients to get to cope and get rid of the secondary problems caused by chronic pain. This very often are prescribed medication, insomnia, depression, lack of energy. So this is an important point. And of course, we then again, together with our clients, go on a journey together to find out what happened back then in your life, what's hindering you from actually applying coping mechanisms. Do you have coping mechanisms? What are your coping mechanisms? What are your resources? Can you reactivate them? So it's a journey based on the therapeutic bond that allows you and enables you to go that path with us. So it's a combination of psychotherapy, of biochemistry, biomolecular restoration, neurochemistry, and it's a bespoke and tailor-made. It's global in a way. It hits in on different angles. How long treatment is likely to last, of course, depends on in what state of health, call it like this, you contact us and you check in with us. It depends on what happened before already, what did work for you, what did not work for you, what is the amount of prescribed medication, how is your social network looking like, and also what are your objectives? Is your objective to get rid of the pain once and for all? Is this what you are seeking for? Has this really brought you anywhere in the past? Do you want to learn how to deal with the pain, how to better cope, how to overall improve your quality of life? So it all starts with the residential start here for whatever time it takes, and then our clients are ongoingly supported in aftercare, and this again is bespoken and contains what is needed that our clients can live a resourceful, happy life to their liking.